Hi students, good evening everybody. Hi students, good evening everybody. Okay students, today we will start with session 2 of continuation of the last topic of what we saw, the human health and disease. So previous class we saw about what is health, what is a disease and how these diseases are caused. So that what we saw in the last class. Now in today's class we are going to see about the common disease, the most common disease, the communicable disease and causing agents. So that will be the objective of today's class. Okay. So before going into our class, let me give you a small review about the last class, the last session. So what was that we discussed in the last session? We saw according to WHO, they said that health is defined as a state of physical, mental and social well-being. There is a definite homeostasis prevailing in people when they are said to be healthy. When there is a disturbance of this homeostasis, then it results in disease. The person with the disease will come with the manifestation of signs and symptoms. So now you have to know that we saw about the classification of diseases. So what were the classification we saw actually the last session? So you could see here the disease we classified as congenital, acquired disease, and again the acquired disease is further classified into communicable and non-communicable disease. Depending on the mode of transmission, we classify that into contagious disease and non-contagious disease. Now, the objective of our today's session will be on communicable disease. Another thing which I would like to tell you all is this chapter is very important. Last time we got around 10 to 12 questions from this chapter. So it is a very important chapter. And the diseases that are caused by pathogens. So they can transmit from one healthy person to another person. So we call that as the infectious diseases. So now you have to know that we are going to today talk about communicable disease. So what are communicable disease? They are nothing but which is caused by some causative organism, okay, that is carried from one person to another person. So communicable, it is going to spread from one person to another person. So that we call it as the communicable disease. So it can spread either directly or it can be indirectly. So we are going to see about the communicable diseases. So this communicable disease, how they are going to be transmitted, what are the common agents that cause this communicable disease, all that we are going to see now. Okay. So we have what are the disease causing agents, that is we saw in the previous session, bacteria, viruses, fungi, protozoa, helminthes, rickettsia, chlamydia, mycoplasma and pyrions. So we saw about all these agents which are going to cause the diseases. So we saw about the bacteria. They are prokaryotes. They don't have their own organelles. But some bacteria, when you see, they are good bacteria, like we saw in the colon. They are going to help in synthesis of vitamin K and B complex vitamin. But what about the bacteria? They are also harmful to the human beings also. So this bacteria, okay, we are going to see in detail as bacterial diseases today. Okay, so the disease which are caused by the bacteria, okay, we call that as the bacterial diseases. So we have a wide range of these organisms, right from bacteria, virus, fungi and even the protozoans, all the helminthes. So they cause various diseases in man. So we commonly called all these organisms which cause the disease as pathogens. So that you have to know. So there is a person by name Robert Koch. Robert Koch is he is a microbiologist, a German microbiologist. Now he gave certain postulations. So after he did a work, he gave his findings in form of postulations. So what he said, a particular organism, you can call it a pathogen or not. How? Depending on certain conditions. So he had some findings. So what are those findings? We will see. So those conditions or criteria, when it met up, you call that organism as what? A pathogen. So that is very important. Okay. So that is very important. That is very important. So you have to know that the conditions are called the Koch postulates, okay, which you should know. And at the same time, like, you also should know what is what you call like we have to know that a diseased animal, okay, let me give you like this. Suppose you are having a organism, okay, you take a human being. Suppose he is suffering from one particular disease, okay, then he should be infected with that microorganism. Point number 2, whatever that organism, it should be isolated and you have to culture it using a medium. So that should be possible. The third one, when you are taking that culture and inoculating, what do you mean by inoculating? You are injecting it into a healthy person, then he should develop that same disease. And the fourth logical point, what he said is the microorganism, okay, you have to get it from that person who got the disease. It should be easily recoverable from that person who is infected with the disease. So the Koch postulate, what we say is these findings. So Robert Koch, okay, he is a microbiologist as well as a bacteriologist. So he gave certain findings. So what was that? When you take the animal which is infected with that particular disease, that organism is the cause. Second, the organism, whatever which is causing that particular disease, you can take it, prepare it in a culture medium. The third thing is, when you are taking that culture medium, injecting it into an healthy will develop that disease. The person who has developed that disease at any time when you can recur or recoverable, or you can take that particular microorganism from that person. So these were the findings that was given by Robert Koch. Okay. Now, Koch postulates is not applicable to two things. We will see what are they. So it is not applicable to two main things. One, to the viral diseases. So when you look into this, as you see, It is not applicable to viruses, because we all know that it cannot be cultured on an artificial media. Then what about students? You should again remember another concept here, the leprosy. So what is happening here in leprosy? The bacteria, that leprosy causing bacteria, it cannot be cultured on an artificial medium. So this bacteria will not obey Koch postulate. Okay student, you are able to follow? See, we are today started with the communicable disease. What is communicable disease? Communicable disease means it is getting transmitted from one person to one other person. Okay, so there is an agent which is infectious. So communicable disease are infectious diseases. Under the communicable diseases, there are many agents which is going to cause the infectious disease, like bacteria, viruses, okay, protozoans, helminthes, like that. Among that, the topic of today's session is bacterial disease. So without knowing about Robert Koch, it will not be fair enough to study bacterial diseases. So we saw that this Robert Koch, the microbiologist, he did some work and he gave his findings as called postulations. So what was there in his postulations? He said that is 4 findings he gave. What was the 4 findings? What was the 4 findings? Number 1, any disease caused by that microorganism. Number 2, that microorganism can be cultured in a media. Number 3, when you take that cultured nutrient, inject it into a healthy person, will develop that disease. And at any time, you can recover that particular microorganism from that person. But 2 things will not be obeyed by the Koch postulate. One is the viruses, because they cannot be cultured, and number 2, the leprosy, because that bacteria will not follow the Koch postulate. So this is what we saw till now. Now students, the next slide will be your logical thinking slide. Please, I will be waiting for your answer. Okay, let us see. For which of the diseases Koch postulates will not be applicable? Number 1, tuberculosis, typhoid, AIDS and syphilis. Please answer students. I am waiting for your answer. Yes, please put it in the chat. Let me see. Yes, what is the answer? Please put it in the chat. So what is the answer? Please post it, put it in the chat. Yes, very good. Excellent. The answer is C. What is that? It is the AIDS. Yes, you are very right. Yes, many of them are giving the explanation. Yes, we will see that. Yes, AIDS is the answer, because AIDS is caused by what? The virus. So in previous slide which I showed you, that viruses will not be applicable for the Koch postulate. Excellent students, very good. Now we are going to see today's topic with bacterial diseases. So what about with this bacterial diseases? See, when I say bacterial diseases, what would immediately strike your mind? What diseases will strike your mind? What disease will strike your mind when I say bacterial diseases? What diseases? When I say bacterial diseases? So it is mostly, when I say bacterial diseases, the students, you will always say typhoid, yeah, TB, yes, syphilis. So these are some of the bacterial diseases quite known to us. Okay, so you can type, students. So when I ask a question, please put it in the chat. Okay, so it is going to be a very interactive section because it is a very interesting topic. Most important topic is the human health and diseases. Okay, very good. Many have answered cholera, leprosy, typhoid, TB. Fantastic, students, you are right. They are the bacterial diseases. So we are going to see in detail about these bacterial diseases, in what are the ways they are getting transmitted, what are the symptoms, is that there is any diagnostic test, and we are going to see about whether they are having any treatment and about the vaccination program. So we will start with the bacterial diseases. Okay, very good, students, you are all very interactive and we will have the same spirit throughout the class. Okay, good. So now we will see about the bacterial diseases. See, bacterial diseases are classified, okay, according to their mode of transmission. So depending on the mode of transmission, we are classifying the bacterial diseases. So how are we going to classify? One, it is the transmission which is through the respiratory tract, or it is the transmission through the GI, or it can be because of some skin wound, or it can be because of the genitalia. Okay, so the bacterial diseases are going to be classified depending on the mode of transmission. I wanted, students, you all to take down this table. Okay, so it's very important, like how they are going to get transmitted. So please take down, students, the points of this. So how they are going to get transmitted? Probably through the respiratory tract, or through the gut, or through some skin bite, through some wound, or it can be through the genitals. So it can be through the genitals like the vagina and the penile organ. So it can be through the penile organ or the vagina. It can be because through the wounds, and it can also be transmission through the gut, as you see, and here through the respiratory lungs. So it can spread through these ways. Okay, so everybody has now known the classification: through the respiratory tract, through the gut, through the skin, through the wound, or via the genitals. Okay, so all have taken these points. Shall I move to the next slide? Yes. Yes, now we are going to see about this interesting disease, the tuberculosis. This tuberculosis is actually a chronic disease. Okay, it is also called Koch disease. Okay, it's also called as the Koch disease. And then you have to know about this disease. What is the causative organism? So this disease is a very chronic disease. It's a Koch disease. It is caused by Mycobacterium tuberculosis. So the infective bacteria that causes tuberculosis is Mycobacterium tuberculosis. Now let me give you an idea like how this disease is going to transmit to another person. So mostly they say that this tuberculosis, when it enters into the respiratory tract, what it does is actually it stimulates our immune system. In reaction with that immune system, what will happen? There will be a granuloma formation which will get lodged inside the lungs. once when the person's immune system slows down, once when the immune system of that infected person slows down, this bacteria will become virulent and it is going to spread throughout the body. So our professors have taught us, telling that TB will affect the entire body except the nails and the hair. So the tuberculosis is pulmonary tuberculosis. Then it spreads throughout the body. So that you have to know. Next thing with tuberculosis, it is going to spread through the infection. How? Through droplets. Like the infected person coughing, sneezing, through that this infection is going to spread. So that you have to be very careful. So it is an airborne disease, droplet infection. Okay, so it is through the droplets from infected person to the other person. Now what are the things? So what is happening? The TB infection starts from a patient with pulmonary TB. So he coughs. So in the form of aerosol, those droplets of that bacilli passes to another person. So they inhale that infected particle and get infected. So another thing, children, please remember, I always say, because I was been in a TB Chetpet hospital there for our pulmonology studies. So there I have seen people who don't take the morning breakfast. They are more prone to develop tuberculosis. So morning meal is like a king's meal. Never ever skip this food. Okay. So when your immune system slows down, it is more prone to develop tuberculosis. So tuberculosis, like what are the symptoms? So the patient will have evening rise of temperature, loss of weight, anorexia. Okay. The person will have anorexia. What mean? Loss of appetite. He will have weight loss, fever, okay, and cough with sputum mixed with blood. So these will be the symptoms with people with TB. Now how are we going to diagnose it? So we are going to diagnose by Monto test. So this is how we do the test, which is called the Monto test. Very important question we get in the MCQ. So what is the diagnostic test that we do for tuberculosis? It is the Mantoux test. Okay. And next, what is the treatment we give? We give what is called the DOTS treatment. Okay. So the DOTS is nothing but directive observed treatment, short course. So this will have a course of antibiotics, okay, like isoniazid, rifampicin and all. So this is the treatment that we give for tuberculosis. Then what is that you can prevent? So the prevention is by BCG vaccine. This is also another important question. So bacillus of Calmette and Guerin. So once the question has come, so they'll ask you like what is the expansion of BCG? It is the bacillus of Calmette and Guerin. So that is a way like when you give that vaccine, like you can prevent it. So at the 0 dose, like once when the baby is born, we give the first dose of this BCG vaccine. So this is regarding the tuberculosis. So what is tuberculosis? It's also called Koch disease. Point number 1. Second, you have to know that it is a chronic disease which is going to be for more than months together, like more than 6 months together. And how is the mode of transmission? It is through droplet infection. And what is the symptom? Fever, evening rise of temperature. They are going to have what is that they are going to have? They are going to have loss of appetite. They will have cough with sputum, chest pain and all that. So what is the test we are going to do? We are going to do what is called the Mantoux test, and that is the diagnostic test for tuberculosis. Sometimes we also do sputum analysis also. But the main test what we do is Mantoux test. And what is the treatment? We give the DOTS therapy, which is a course of antibiotics. And what is the vaccine? BCG, bacillus of Calmette and Guerin. So this is the vaccine we give. So you are all able to follow, students, what I have asked. So with the tuberculosis, yes. Now I will ask you a question with tuberculosis and I want you to reply back in the chat. Can you all tell me what is the other name for tuberculosis disease? Please reply. Fantastic students, excellent. I am very happy. We are all very interactive, very happy. So this is what I wanted. Very good students. So it is also called the Koch disease. Very good. Yes, excellent. So the next would be the another set of diseases that is going to spread, which we call it as pneumonia. Okay. So we are going to see about the pneumonia. So now in pneumonia, it is nothing but it is mostly the disease which affects the old people mostly or the very young children. That you have to know. Okay. And another thing students, please, when I am putting the slide, please write the causative organism. Make a note of what I am telling, which is very important from examination point of view. So please take down, as I am going very slow only. So please take down the name of the organism and certain important points which I am giving you. So now we will see. It is the infection of the lungs. Yes. So what is happening in pneumonia? Now it is caused by Streptococcus pneumoniae or Haemophilus influenza. So what is the bacteria that is causing pneumonia? Streptococcus pneumoniae or Haemophilus influenza. Now what will happen once when this microorganism enters, okay, when it enters into our lungs? We have what is called the alveoli, right? Now the alveoli, okay. So now what happens, this alveoli, it will get filled with the fluid and mucus, okay. So what will happen? There will not be any gas exchange. So no gas exchange is possible. So that is what is happening with pneumonia. So pneumonia is characterized by the infection of the alveoli and bronchiole. So what is happening there? The bacteria, when it makes its entry inside the lungs, it causes the fluid to get filled in the alveoli. So what is happening in the alveoli there? So once when it gets filled with it, there cannot be any gas exchange. So these people will have low oxygen level in the blood. That is what you are also observing in the COVID patients. Yes, you are seeing the COVID patient, what they are also at end part of it, they have pneumonia like symptom, breathlessness, chest pain, less oxygen. So all is pneumonia like symptom. So how is this transmitted? So this name of the organism, please note it down, very important MCQ point of view. Streptococcus pneumonia or Haemophilus influenza. Then when an infected person, when they cough, sneeze, it is again airborne. So that organism through the droplet will spread to the next person. So it is mostly transmitted how? Through the droplet infection. So that you have to understand. So they will ask question like this. Pneumonia is transmitted by, it is by droplet infection. So that you have to know. So what are the symptoms we are going to see? They will have a very high fever. They will have a very high fever with chills, and they will have a characteristic chest pain, difficulty in breathing, and the sputum will have mixed with blood. The sputum will be sputum, okay, they say chali in Tamil. The sputum will be mixed with the blood. Okay, so that is very characteristic. And what is the treatment that we give? Mostly we go for antibiotics, very broad spectrum antibiotics we give. And apart from that, we are going to give what prophylaxis, avoid smoking, pollution, and we teach them to maintain a good hygiene. So these are all some of the prevention or prophylaxis we take against bacterial diseases. So pneumonia, it's more common in old people and very young children, but it can affect any age group. So it is infection of the lung. So what is the causative organism? Streptococcus pneumoniae and Haemophilus influenza. So this microorganism, when it enters inside the lung, it is going to damage the alveolar membrane. So there will be mucus or fluid filled in it. So what is going to happen? There will be no gas exchange because it is filled with water. So there will be no gas exchange. So that person will have shortness of breath and low oxygen level. So that is why they have the chest pain, breathlessness, and apart from that, infection, fever, chills and all that. Okay. And then they will have cough with sputum which will have blood in it. So we give them a very broad spectrum of antibiotic therapy. And what is the prevention for that? We have to maintain a good hygiene, prevent smoking, tobacco, all that is the prevention measure. Okay. Okay, students. Now it's all fine. Everybody, shall I proceed? Yes, you're all able to follow, students. Any doubts as of now? Any doubts, ma? So far, we are seeing the transmission through the respiratory tract. First, I taught you about the tuberculosis. The second, we are seeing about pneumonia. We finished it. Yes? Okay. Then, now we are going to proceed to diphtheria. This is the disease which is caused by the bacteria which is called the Corynebacterium diphtheria. Now here this Corynebacterium diphtheria will spread through droplet infection, same like the pneumonia. Now what happens? Usually the person who is infected may be asymptomatic, they don't show symptom, but they spread to the other person, or through touch with some contact object also the disease might spread. So it is mostly through droplet infection. Around some 2 to 5 days afterwards, immediately they will get the diphtheria. So what is the reason? So what happens? This bacteria, it will destroy that epithelium of that respiratory tract, all that epithelium. There will be accumulation of various substances which will make what is called pseudomembrane. Pseudo means false. Okay. Pseudomembrane. Okay, it is the pseudomembrane. So what will happen? That membrane which will develop will close the respiratory passage, so that the person will not be able to breathe properly. Suffocation will be there, particularly children. So they will have that breathing difficulty. So that might even lead to death also. So what are the characteristic thing? The child will have fever, chills, then it will have that rigor and also breathing difficulty, chest pain, drooling, and they will have that suffocation. Why is that suffocation? There will be a development of false membrane because of that epithelium destruction caused by this bacteria, and that is going to close the passage. They have that suffocation. So that is characteristic. So they will have what is called the sore throat. Okay, that sore throat will be there with cough, fever and swelling of the lymph nodes. The lymph nodes you can palpate it. So that will be very characteristic. Apart from that, breathing difficulty will be there, chest pain will be there, and sometimes there will be cough with blood mixed with the sputum or through the nose also. Very, very fatal. So what is the bacteria? Corynebacterium diphtheria. So we have finished so far. So what is the the treatment that we do give? So mostly we go for antibiotics. Okay, and the best thing what we do give here, the vaccine, is the DPT. D for diphtheria, okay, and P for pertussis and T for tetanus. So usually we start this vaccine by 2nd month of the baby when the baby is 2 months, and then we follow by booster doses. So children, please make a note of some points which I am giving you. They are very important. Okay, so diphtheria is caused by Corynebacterium diphtheria, and what is the prevention from the examination point of view? It is DPT. It consists of 3 combination: diphtheria, pertussis, which is that whooping cough, then T for tetanus. So all 3 mixed we are going to give for this disease. Okay. Now we are going to see about the disease which is going to spread through our GI. That is what we are going to see. So here, so far any doubts, students? You're all able to follow? Yes? Any doubts? Okay. So here we are going to see about the typhoid. The typhoid is also called the enteric fever. Typhoid is also called what? Enteric fever. What do you mean by enter? Enteron. When I say enteron, that means what? Small intestine. So it is going to affect the small intestine. And then it is caused by the Salmonella typhi. How it is going to be spread? By contaminated food, contaminated water, and through probably through the feco-oral route. Okay, mostly through the feco-oral route. It is going to spread through that. So what are the symptoms that we see? The person will have a very high fever, like it will be more than 1 or 2 degree Fahrenheit. They will have a very severe headache, weakness. Sometimes they will have abdominal pain with constipation. But they will have a characteristic what is called rose spots on the chest. So fever with rose spots, immediately we will ask them to do the test for typhoid. You are able to follow, students? So what is that with typhoid? So typhoid, it is nothing but enteric fever. When I say enteron means what? It is something going to affect the intestine. So what it is going to do? This bacteria through the contaminated food or through contaminated water, yes, or through feco-oral route contamination, it is going to go sit in the intestine, make the intestinal perforation. What is intestinal perforation? It is going to go and make ulcer like lesions. It will go. So what will happen? That person will have GI bleeding. So he will develop all these symptoms. Okay. So fever with the rose spots is characteristic of what? Typhoid fever. So here comes our madam, the Typhoid Mary, who is also called the Malon Mary. So she was actually a cook. It's a story. Now we'll all relax. We have been discussing subject for quite long time. Now I'll tell you a nice story. She is actually a cook she was working in a family. So she developed a typhoid, contracted from one person, and she was having that disease. And she, as a cook, as she's become a carrier, and she was spreading to many people, like it was like an epidemic outbreak. Then the government wanted to trace and find out who was it. Then they found it is the super spreader, Malon Mary, Typhoid Mary, and they asked her to come for test and all. So she escaped from them. It was a big story, like she escaped from them. She went with another name and modified her identity. She was living like that, and probably she was going around not following all that, and by 70 years she had a stroke and she died. So even now, so typhoid, when we say that carrier, that point is very important. She was a positive carrier for this disease, and she was keeping on spreading it to other persons also. So that is where the typhoid, it became a very big epidemic at our European countries at one point, and this was the story behind the typhoid. Okay, we will resume back. Now what is the test that we do for typhoid? So we know that a person is coming with that high fever. We say ladder like increase in fever, and they are having the abdominal pain with the constipation, and sometimes diarrhea also they will complain. So what will be our diagnostic test? We do a test, very important MCQ. Vidal test. So what is the test that we do? Please make a note of it, children. Very important, Vidal test. So this test we will make, and it is going to confirm that disease. Now what is the treatment we give? Antibiotics like chloramphenicol, like that we give the drugs. Okay, it is just a not from the examination point, but just for your information I am giving you. So that is the one we are giving to treat the disease, and we have vaccines for typhoid which can prevent the disease. So what measures are we going to take? How are you going to prevent? One is avoid taking of that contaminated water or food. So eat properly cooked clean food. Hygiene is important. Then proper disposable of waste, that sanitation, all that is important. And apart from that, the vaccines. So which I told you, that what you call vaccines, we have typhoid vaccines followed with booster dose. So that is the remedy that we can provide. So I taught you about the typhoid, which is an enteric fever. It is spreading through bacteria, Salmonella typhi. How it is getting transmitted? Contaminated food, contaminated water, and fecal-oral route. Like you can see this outbreak particularly during following the rainy season, because the contamination will happen. And then the person will come with fever, but very characteristic, that rose spots. Okay, so that is very important. Then the Malone Mary and her story I told you. What is the diagnostic test? Vidal test. And what is the treatment? We give antibiotics. And then we are going to prevent it by proper sanitation, proper hygienic conditions, eating good food, well cooked food, clean safe water, and vaccines. Vaccines are available. Okay. So prevention, it can be controlled by avoiding contaminated food and water. So that is important. Okay. So next, coming to another disease, cholera. When I say cholera, okay, this was one time a big epidemic outbreak in the world. Like now how we are having the COVID-19. Same time we had cholera once as an epidemic outbreak. It was caused by the bacteria called VIBRIO cholerae, which is a comma shaped bacteria, like a comma. Okay. And it is going to affect the small intestine. This bacteria will produce some toxin substances. This toxin substances will stimulate those epithelial cell and cause more release of loose stools, which is the diarrhea. Okay, so what is the mode of transmission? Probably when we say cholera, it is through the fecal-oral route. So once when the cholera bacteria, the VIBRIO cholerae, when it enters inside our, so please take down the name, it is a very important MCQ. So cholera is caused by VIBRIO cholerae, okay, and once when it enters into our GI tract, either to the fecal-oral route contamination, what it is going to do? It is going to cause the epithelial cells to release large number of water and ions, and they are lost in the form of diarrhea. So what you have to know here, see, through either through the water or through contamination, it is going to enter here. So once when it comes to the intestine, see, it is a comma shaped bacteria, as I told you, see, and this is going to stimulate these channels. So what will happen? All the electrolytes like sodium, chloride, everything will be there. Along with that, the water will also be lost. Okay, so what will be the characteristic thing here is the first symptom, we say rice water stools. The person will have rice water like stools. So like more amount of water will be lost. So they will be more dehydrated. Sometimes they will have vomiting also. So these people will have abdominal pain, vomiting, and along with that rice water like stools, they will keep on passing. So what will happen once when the water is lost in this form with no input? What will happen? Definitely they will become dehydrated, because water is lost, the electrolytes is also lost. So what is the treatment that you are going to give? So we are going to give the ORS, the oral rehydration, that is which will have the salt with the sugar. That solution, the ORS solution, we will give them. Either if they are orally they can take, or we will put them in saline, and we give them antibiotics. Prevention, we have to prevent. So safe drinking of water, sanitation improvement, and proper environmental hygiene. All these are the methods by which you can really protect people from developing cholera. Okay, so cholera is caused by the bacteria VIBRIO cholerae. It's a comma shaped bacteria. What is going to do? This bacteria is going to cause the epithelial cells to release more of those electrolytes, and water also follows. It just goes and open all the channels. It is going to open all the channels in the small intestine, and what it is going to do? Open everything. So the electrolytes will come out, water will come out, they'll have rice water like stool. They'll keep on passing. So dehydration. So you have to rehydrate them by saline or ORS. And then we give them antibiotic therapy. Along with that, prevention is important. So we have to take that hygiene part as well as the sanitation, proper disposal of waste. All that is important because cholera spreads through fecal-oral route. Okay, so this is with cholera. Now I have a question for you all. Yes, what is that question? Fever with rose spots, you see where? In which disease? Fever with rose spots, in which disease you see? Why in diarrhea actually we can take ORS. Only in dysentery we have to wait for. ORS is nothing but it will have that salt and sugar which will prevent you from becoming prevents you from dehydration actually. We have to take antibiotic therapy. Apart from that, we will give them ORS also. Okay, ORS is something, instead of saline, you are taking that in the oral form. It's an oral rehydrating treatment. Okay, so what happens whenever you are taking salt, the sugar also follows it in absorption. So water also is getting absorbed. So it is one way where you can make yourself rehydrated. So usually we give in diarrhea also. Okay. Yes, very good students. Typhoid is the answer. Excellent. So typhoid is the answer, where fever with red spots. Fantastic students, fantastic. Yes, excellent. So we'll proceed to the disease that is transmitting through skin bite or through wound. So we have the plague. Again, this was once an epidemic outbreak. Yes, it was caused by the bacteria Yersinia pestis. Please make a note of it. The bacteria which causes plague is Yersinia pestis. Now this bacteria, we will see how it is spreading. Mostly the infected fleas, they are the one, when it bites the human, through the bite, skin bite, it is going to get transmitted into human. First we will understand what is happening. Now this bacteria Yersinia pestis is a parasite. It is going to go live on these fleas. Now these fleas, when they bite the human, the disease is getting transmitted. So that is how they develop that rat fever, okay, which is called the plague. Now plague actually will have two types. We have bubonic plague and we have the pneumonic plague. Bubonic plague will affect the lymph nodes, the characteristic lymph nodes. So they will be enlarged. But what about the pneumonic plague? It will affect the respiratory system. So the person will have fever, rashes, and particularly the skin will become black. Okay. So there is a high mortality, death following the plague. That is why we call as black death. So whenever I say plague, it is caused by the bacteria Yersinia pestis. This Yersinia pestis will sit on that fleas as a parasite. Now once when these fleas bite the human, they are going to develop the plague. It can be either bubonic, like they'll have enlargement, buboes we say, enlargement of the lymphatic nodes, or it can affect the respiratory tract. So that is why they are very, very dangerous. So it can spread from that fleas to the human, plague. Okay. So next is the leprosy. I hope you would have come across this. So when I say leprosy, it is the Hansen's disease, which is named after the person who discovered this. So leprosy is caused by Mycobacterium lepromatosis. Please students take a note. and it is also caused by Mycobacterium leprae. Okay, Mycobacterium leprae. So that is where you need to understand. So you are having Mycobacterium leprae. Now what is the current thing that you need to understand? First thing, the disease, it will spread through contact, prolonged contact mostly. I have worked in Gramaltus Leprosy Center, where I have been trained to treat these leprosy patients, particularly for testing them. So they say that prolonged contact of people, they develop leprosy. It will affect the nervous system, skin mostly. Okay, so there are two types of leprosy. One is called tuberculoid leprosy. Another one is called lepramatosis leprosy. So students, again I am telling you, please make a note of it. The leprosy is caused by Mycobacterium lepramatosis. It is also called the Hansen's disease, named after the discoverer. When there is a prolonged contact with that leprosy patient, we might get. So the point of contact, that is a mode of transmission. It affects mainly the nervous system and the skin. So you find a change in the skin color, lightening of the skin color, and probably after some time it affects the nerves. So there will be development of the deformities like this. So there will be change in the skin color with deformities like this. So what is that we are going to do? So the colored patches will be there. Two types of leprosy we will come across in clinical cases, as we have seen. One is called the tuberculoid, another one is lepramatosis, that you know. And another thing is, we will do skin biopsy test and we will tell, so that at one point of time these people will lose the sensation. So there will be sensory changes also. Okay, sensory changes. They will not have that feel of senses. So that is also very characteristic. We will do lepromin skin test, skin biopsy. We take the pinch of skin, check for the presence of Mycobacterium leprae and treat. We give them antibiotic treatment with a vast of tetracycline, all the drugs we used to give. So that is with leprosy. Okay, so leprosy by Mycobacterium leprae, Mycobacterium lepramatosis. Okay, it affects the skin, the nervous system, that you have to, particularly peripheral nervous system. So there will be change in the skin color, the nerves will be affected, all that you should remember. Okay. So next we are going to see about tetanus. It is a very characteristic, what we call it as the lockjaw disease. I hope you all know this. Okay, tetanus is because of the bacteria Clostridium tetani. So how it is going to enter our body? Probably through wounds, when there are open wounds, bruises. Okay, so probably through that they are going to enter inside, even through bites. Okay, so usually when somebody bites, usually we see in the school kids. Okay, so what happens? With small quarrel they'll bite and all that. So wounds, infected wounds, bruises, when some rusted iron makes a nick on the skin. So all this. So once when the bacteria enters through this into your skin, into that wound, when it is entering, it will release some toxins. They are very favorable for your nerves. Immediately it causes stiffness. What do you mean by stiffness? The spasm. Increased stiffness is spasm, particularly of the jaw. Like that it will be of the neck, and they will develop that convulsion. Sometimes they die also. You won't believe, the person, it will be like this. The entire body will be arched like this. I have seen patients with tetanus. So this is characteristic. So imagine a person with tetanus, he will be like this only, arching like this. The head, the toe, the entire body will be arched like one bow with a lockjaw. So much stiffness they will have because of Clostridium tetani. It is a neurotoxin affecting all the nerves, causing stiffness of the muscle. So that is very important. So how are we going to prevent this? We are going to prevent this by putting the injection, DPT, the vaccination. So tetanus vaccine or TT in adults. In children we put this along with the booster dose. What about here? TTT. What is DPT? Diphtheria, pertussis, tetanus. Here TTT, tetanus toxoid. that we put as injection. So that is how we are going to prevent ourselves from getting the tetanus infection. Okay, so now we are going to go for the last part of it, the transmission through genitals. So what is before going into genitals, I hope you understood with skin through bite and wounds. I taught you about plague. What is the organism? Escherichia pestis. It is going to first sit on the flea transmitting to the human. Okay, so that is important. Second, in leprosy, prolonged contact, Mycobacterium lepromatosis or Mycobacterium leprae. What about here, children? Here, tetanus, lockjaw disease, Clostridium tetani. This bacteria is a neurotoxin and it is going to increase the stiffness of the muscles. Next, we are having the transmission through genitals, the gonorrhea. It is mainly caused by Neisseria gonorrhea, the named after the discoverer, Neisseria gonorrhea. It is a venereal disease, which means sexually transmitted disease. So what is the mode of transmission? Through the sexual contact, through sexual intercourse. So in men, they will have a characteristic signs. Okay, they will have pain during micturition, passing urine, or they will have discharge of pus or some fluid from the penile organ. Whereas in female, they will have that vaginal discharge with pus, foul smelling pus, or they will have pelvic inflammatory disease and all. So sometimes the vas deferens and the fallopian tubes will also get affected. So they will have infertility or sterility. So they can ask you this, which STD will lead you? It is the gonorrhea. So gonorrhea is caused by Neisseria gonorrhea. So in men, they will have these issues, and female, they will have that vaginal discharge. So what will be the treatment? We don't have any vaccine and all. The treatment will be avoid of the sexual contact. So that will be the treatment, and we will give them with the antibiotics, a broad spectrum of antibiotics. Next comes the syphilis. Please take down, students. It is caused by Treponema pallidum. The syphilis is actually the infection, okay, which is most common, and it will spread through the many stages, like we have primary, secondary, every level. It will involve every parts of the systems of the body. Now first it will cause like ulceration in the genitalia, then it will slowly spread through the lymph node, then it will affect the cardiovascular, nervous system, and it will affect the entire body. Suppose if the mother is infected with syphilis, okay, so what will happen? The child will be born with stillborn, means after, like before born, the baby will be died, it will be dead, or it will be like blind also. So that is so important, because it is transplacental. What is transplacental? That means it can cross the placenta and infect the fetus. So mostly blindness is reported following the syphilis infection. Okay, and mostly through homosexuals are having multisexual partners is the issue with syphilis. So syphilis, Treponema pallidum, transplacental point, you remember, because it can spread from mother to the child. If the mother is having syphilis, it can spread to the fetus also. So once the baby can die in the womb itself and it can be born, or if at all it is born, it will be malformed. The most common will be what? Blindness. Okay, that you remember. Okay, so far clear, students? And next, coming to another zoonotic disease, anthrax. It is caused by Bacillus anthracis. So here what is going to happen? This Bacillus anthracis, when it enters into the human, it actually mostly affects the herbivorous animals. Okay, so once when it affects those herbivorous animal, from them it is going to affect the human. So it will affect the skin, then the lungs and intestine and all. So probably from the infected animal or by inhaling spores. So mostly it will start with a skin ulcer. Even people will develop that difficulty in breathing. So what was this question is important. Like Robert Koch made his findings, the postulations which we discussed. So how did he arrive at it? Probably after working with the disease anthrax, that microorganism. So they can ask you this question. So anthrax is also a bacterial disease. It's a zoonotic disease, we say. Okay, that is, it's coming from animal to humans. So it is probably by Bacillus anthracis. So mostly it affects those herbivorous animal. So once when it gets entered, it affects the skin, then it causes skin ulcer, then it affects the lung as well as the intestine. So we call it according to the stage, and then it is going to cause various ulceration, difficulty in breathing and all that. And anthrax was the disease, and that bacteria was studied in detail by Robert Koch, and that is how he arrived with the postulations. Okay. Shall we move on to the question session, students? Yes? Yes? All are ready? You understood with today's class? Can we move on to the question session? You are all ready? Yes? We will start with it. So now we will see what is Vidal test is carried out to test malaria, diabetes mellitus, HIV, typhoid fever. I am waiting for your answer. Yes, come on, put it in the chat. Excellent students, very good, very good. It is called, the answer is D, typhoid fever. It is an agglutination test where we are going to test the presence of antibodies against the Salmonella organism. Okay, so that causes the typhoid fever, the diagnostic fever. Malaria is not through that. We have another test. Diabetes with the blood glucose level. HIV is a viral infection. That is different. ELISA. So, Vidal test for typhoid fever. Excellent students. Good. Next, name a bacterial disease which is commonly called lockjaw disease. Waiting for your answers. What is the answer? Yes, very good. The answer is tetanus. The answer is tetanus. Okay. Lockjaw disease. It affects what? The nerves, which I told you, the neurotoxin. So it causes the stiffness. It is called lock. They will not be able to open the mouth. It's called lockjaw disease. Tetanus. You are right. Again, very good. Next, to which the name of Mary Melon is associated? Yes, excellent. Very good. It is associated with typhoid. Mary Melon is associated with typhoid. Very good. Very good. Shall we move on to the next question? Very good, students. Very good. So the next is, that is caused by Treponema pallidum. Many have put the answers now itself. We will wait for some more answers by others. The answer is syphilis. Yes, you are right. So Treponema pallidum leads to syphilis. Mary Melon associated with typhoid, that cooking Mary, and then lockjaw with tetanus. So in today's class, I gave you a very clear idea about what are bacterial diseases, what is the mode of transmission through which it is going to spread. If it is through the respiratory tract, we saw today about tuberculosis, we saw about pneumonia, diphtheria. If it is through the gut, today we saw about typhoid, we saw about cholera. Yes, and then if it is through skin, the cut wound, or through the infected wound, we saw about the tetanus. Then we saw the plague. Yes, so that is important. Next we saw about through the genitals. It is the syphilis, and then we saw the gonorrhea. So very important, children. Please read the name of that disease. What is the microorganism and what is that thing? Now last, before winding up, I will ask one question. Okay. Okay, will you all are ready? I'm going to ask you a question. Please be ready. Which is called Hansen's disease? Yes, very good students. It is none other than the leprosy. So I hope you all understood the class. Was the class interesting? You were able to follow? Yes, students? You were able to follow? Any doubts? Any doubts, students? Yes, everybody were able to follow? So we will meet you in the next forthcoming session. Okay. Thank you, students. Have a good week.